For the last year, our cameras have had special access to one of Britain's largest cancer centres.
Good morning, Velindre Hospital. Can I help you?
We've seen the life-changing challenges faced by patients and their families.
It's been a bit of a worry for you and mine, hasn't it?
Yeah.
And the passion and expertise of the army of dedicated staff.
There's something unique about working in Velindre.
And that makes this a pioneering, world-class facility.
Velindre is one of the leading lights in the world for oncology and for palliative care.
From heartbreak...
Come on, then.
...to hope.
You have to go to a diet like the rest of us.
This is the story of a place where few of us in Wales would choose to spend time.
I'd quite happily be famous for anything else, really, than being a very positive, ill person.
And yet it really is one of our national treasures.
This is a miracle place.
Yeah.
You can feel the hope within the walls.
Treatment for cancer is a daunting prospect. Even the drugs used to fight the disease take their toll on the body.
I am wearing a wig at the moment. I think that's the worst thing, is when a lady loses her hair. It's not very nice at all. I had no signs whatsoever, and then my tummy just swelled up quite big, as if I was pregnant.
Oh, there's you and Roy Orbison.
That was when they found out, you know, that I had cancer.
Carol has been diagnosed with ovarian cancer and is about to start her treatment at Velindre. And by her side, from the very beginning, is her husband Tony.
Having family involved is essential, certainly when you first time you see them. There can be a lot of miscommunication and a lot of understanding. We give them a lot of information. There's no doubt we spend 30 minutes or an hour with them, and we know that patients will only remember 10 or 15% of what I talk about. So having family members with them to help make sure that they get all the information is absolutely essential.
My husband's been absolutely wonderful. He's in with the housework, he does all the cooking, and he really looks after me. When you're first told you've got cancer, it's such a big shock that you just can't believe it. And I never expected to get anything like this at all.
Hello.
Hello.
Hello. Hello, I'm Dr. Hudson.
Good morning.
Not knowing what to expect only adds to the stress. Carol is about to find out what's in store for her.
What will be back today is your kidney function, your liver function, and your full blood count and your white count, and those are the things that the chemotherapy really affects, because we're aiming to give you 3 lots of chemotherapy with a view to surgery potentially, aren't we?
Yes, and that'll be a full hysterectomy, will it?
It will.
Yeah. And then if everything's not gone, then it's chemotherapy again, is it?
It will be chemotherapy again anyway.
Oh, will it?
It will, for another 3 lots of chemotherapy to mop up any cells that the surgeons haven't taken away.
Oh, I see.
And that's completely standard. We do that on absolutely everyone, so that's normal. And take it from there.
Oh, that's lovely.
Okay.
Yes, thank you
right.
very much. Lovely to have met you.
Lovely, thank you.
Now that she knows a little more, Carol can prepare for what lies ahead. Michael is also here for an appointment, which he hopes will throw more light on his prognosis.
I was diagnosed with the rare type of cancer, which is spindle cell sarcoma of the distal femur. It attacks the bones, eats away the bones and makes fracture.
Mike has always been a strong person and he's always been there for me. And now it's the other way round. And I'm struggling, I'm really struggling with it. When you're first told nothing goes in, it's just as if you're living in a dream world and they're telling you things. And then when you get home and you're trying to process it, and you think, well, did they say that or did they say this?
I didn't realise what it was going to be like. You see people going through it and you never realise how tough it is.
Joining them today is Eileen, a third-year medical student from Cardiff University.
How is your hand actually?
It's gone down.
Is it going down? Yeah, it's still up.
Yeah, it's still hot. Are we out?
For the next 5 months, Eileen will be following Michael as part of a pioneering scheme to pair students with cancer patients. As well as academic work, tomorrow's doctors will get hands-on in clinics, wards and operating theatres as they learn what the patient experience is actually like.
In the oncology project, they have an opportunity to really get to know the patient. It's very different for them being on the other side of the table and waiting around for the patient to start treatment.
Yeah.
Spending time with them whilst they're waiting for their chemotherapy to start.
Pardon?
What all bloods are you checking?
Full blood count, UNEs.
We're with the patient coming to these clinics and we're sitting waiting on them when they're waiting hours and they're waiting on results and tests and getting things explained to them. So I think it'll make us in the future as future doctors a lot more empathetic to their situation and to how it feels, the whole thing, how frustrating it can be at times and everything. I think it'll make us a lot more empathetic to that and be able to understand it a bit more, I think.
Eileen is not the only medical student to benefit from the oncology project.
Hello. My name's Ellen.
Hello,
I'm
pleased to meet you.
I met up with Carol and her husband for the first time.
This is my husband, Tony.
Hello, Tony.
We follow a patient from their diagnosis through their treatment, sort of get to know the patient. So you're going to the chemo day unit today, is it?
Yeah, today, at 9:30.
She's absolutely lovely, but was sadly diagnosed with ovarian cancer at the end of August. Considering it was so new, I was surprised how positive she was already. How's that feeling, okay?
Okay, yeah.
Good. Yeah. There we are. Do you mind if I just go and have a quick look at your notes? Is that okay? Oh, brilliant.
Each regime has different pre-medications and kind of routine we follow. So day one is obviously the start of it, and it's a 3-week cycle.
Is this an antihistamine?
Yeah, so chlorpheniramine, Piriton.
Yes.
So this is what she's...
For Ellen, mastering the medical jargon is vital. But she's also learning another important lesson, the emotional aspect of dealing with cancer.
I haven't said anything to anybody how I really, really feel. And at the moment, you feel, oh, well, am I going to be here next year? You know, am I going to walk around my garden again? So I went yesterday to see my sister, my older sister, and she's like taking over the part of my mum, if you know what I mean. I could talk to her, and for the first time yesterday was when I had a good cry. I broke my heart because I started losing my hair. And that I felt better after through getting it out, you know, because I'd never cried before, have I? Because Tony won't talk about it, and that's not really good.
Your hair looks very good at the moment, so
yeah,
hopefully.
No, yeah, she takes one over, so yeah.
You're a man.
Well, yeah.
Yeah, that's right. They don't understand, do they?
Because, you know, I've obviously gone a bit thin.
She's been absolutely brilliant. She's not had many side effects. She's still doing the hoovering, she's doing housework, she's doing everything she was doing before. She's been really positive.
Keep going.
Yeah.
Keep going, Carol.
Back in the outpatient clinic, there's a crucial blood test underway. Michael needs a positive result if his treatment is to progress as planned.
First of all, this morning he's getting his blood checked to see is it okay for him to go ahead to start his chemotherapy today. Basically, they're looking to see his white blood cells. If they're too low, he can't start the chemo today and they'll have to wait another week before they can start it.
Excellent. Okay, thank you very much.
Thank you.
See you next time.
Yeah, thanks.
Thank you. I've never had any family with cancer, so I've never had to deal with anything like this before.
So, wait now for results now?
Yeah.
And then they can decide whether or not we're going in today or not.
Hopefully.
Sitting and waiting looks a lot easier than doing demanding coursework. But for a would-be doctor, it's a really valuable lesson.
Just being the other side of the desk, seeing the patient's perspective on everything is amazing. It's very, very eye-opening.
The wait goes on.
How do you be sick?
It's lunchtime.
Some salt and pepper, Mike.
Yes, please.
I haven't had a decent meal like that.
Michael's appetite seems fine, but frustratingly, the news from the lab isn't so good.
The blood results have come back that white blood cells are too low to go ahead with the chemotherapy today. So that's obviously going to prolong everything for a week.
Neutrophils need to be above 1.
Okay.
And he's coming in at 0.6.
Oh, so you're just below.
So
by putting the chemo back. Surgery's going to be back a week. I don't think they're going to be that too happy, obviously, but it's one of those things you can't help. It's the thing, because obviously your system, you're getting so much pumped into you. No wonder your levels are so low.
It's just not giving you time to recover. And it's really to build those neutrophils back early.
So Michael has to head home and hope for the best next week.
It's really hard. You need a lot of strength to get through it. It has knocked me for 6. It's completely drained me.
A week has passed and finally Michael's blood count is back to normal. He's back at Velindre for his chemotherapy.
Here she comes.
Excuse me?
Another 6 hours then.
It is, I'm afraid. Got nothing better to do with you?
No, I don't seem to have.
Overseeing Michael's treatment is Dr. Owen Tilsley, a specialist in bone cancers.
So what we're looking at here is an X-ray of Michael's thighs and the top of his knees. You can see that the X-ray is darker in this area here and a bit brighter here.
And that's what it's all about. That bulge were there. That's where they went in, took a biopsy. They could find out what type of cancer it is.
Osteosarcoma is very rare. It's around about 2 or 3 per million per year.
You would never, ever associate that with being cancer. It was just a twisted knee.
With a rare condition like this, everybody's going to think of a torn ligament, sports injury, something like that. So catching these things early is difficult. Nobody's going to be thinking about a bone cancer, and your average GP will see less than one of these in his entire lifetime.
Unfortunately, this is not just a rare cancer. It's an extremely fast-growing one.
It's come up
8 centimetres.
Sorry, 80 mil.
Yeah.
So in 3 months, if it's grown that bad, it's pretty aggressive.
It tends to occur in adolescents and young adults, so he is unusual in having a teenage-type tumour at his age. That's posing problems because the treatment is designed with teenagers and young adults in mind, so I wouldn't be surprised if he's having a difficult time. Actually, I think he's coping reasonably well, you know, given that he's having pretty toxic chemotherapy.
The first 2 weeks are the worst now when we go home.
Yeah.
It's 10 days of me being a zombie. Constantly sleeping and being sick.
And after all that, Michael still faces a major operation to remove the cancerous bone and rebuild his knee joint. Carol is also going through chemotherapy for ovarian cancer. One of the side effects is really upsetting.
Broke my heart because I started losing my hair.
Today, as she undergoes another dose of chemo, Carol has elected to experiment by wearing a cold cap, a device that some patients find minimises hair loss.
You've got to try it, haven't you? Yeah. Don't try it, you don't know, do you?
Some people just say, no, do you know what, I'm going to shave it off, wear a wig and get through it, because obviously it adds on extra time, and other people are like, no, I'm going to give it a go.
Yeah.
And you've got peace of mind then. If it didn't work, well, you try.
Well, that's right, you've lost nothing, have you?
No, exactly.
It's only 50-50, but it can save some of your hair.
How does it feel when it's on your head?
It's like having a big hairnet on. It fits nice and tight on your head, and then they run ice-cold water through the top.
Can you push down on the top for me? If you just pull down, pull it right down. Does that feel good?
Yeah.
That's nice and tight there. How does that feel?
OK.
Is it too tight on your chin?
No, it's all right. I've always looked after my hair, and I've always liked it to look nice, so it came to a big shock when I started losing it.
It looks a lot different than I thought it would when they said a cap.
Cardiff University medical student Ellen has been paired with Carol. It's part of a groundbreaking oncology project, educating tomorrow's doctors in the realities of living with cancer.
I just thought it'd be sort of, like she said, the surgical cap.
Oh, yeah.
I didn't
This
realise
is the first time you've
I've
seen
never
it as
seen
well.
Them. Yeah.
Oh, it's just freezing cold, like ice it is, just like ice on your head. Just worth putting up with, isn't it?
Is it difficult to talk with the strap?
Yeah.
As Carol waits to find out if the cold cap has worked, Michael has returned for an assessment to see if his chemotherapy has done its job.
Today now for my MRI scan to see if it's shrunk. Just waiting for the results and hopefully get this bit cut out before Christmas. So we'll have a nice Christmas present, a new knee and a bit of leg.
Have you ever had kidney failure?
No.
It's evident that walking is increasingly difficult for Michael. He needs that operation. Today's MRI scan is crucial so that the medics can see exactly what has to be done in surgery to strip out the diseased bone and rebuild his leg.
It's blindingly obvious that this is what it should normally look like. And this is fluid.
Right.
Around the outside. So fluid on this one, this particular sequence shows up very white.
Anyone can see looking at that, like you don't need to be a medic or anything to see that doesn't look quite right. You can see how weak Michael's bone is. That's obviously why it's very difficult for him to walk, because that bone in his leg is so weak because the cancer has really corroded almost through it.
There's no firm, hard, solid bone to stick anything in there. That's going to affect his mobility, which is going to affect his quality of life massively. We'll get you stick by the door so you can get to it as soon as you get closer.
The scan has laid bare the physical challenges Michael faces, but his wife Jackie also worries about the emotional stress he's going through.
Don't get me wrong, this is really, really important, and he needs his op.
Yeah.
But he also needs some time with the family as well, because he's been sort of quarantined for so long.
Yeah.
No mates have been over, the kids haven't been over, the grandchildren haven't been over. He hasn't seen anybody.
The role of home life during cancer treatment and recovery afterwards is something that's crucial for the medical students to understand.
So today we were out visiting Mike and Jackie in their house here in Bridgend.
Because as soon as I am eating, I'm being sick. It's not staying down.
I think it's really important from my perspective in terms of the oncology project. It's seeing them where they're comfortable and seeing how they're dealing with everything.
So whatever hit his stomach first thing would come back out.
Oh, so you were eating? I think they're just kind of now getting ready for the surgery.
Day has finally arrived for the operation.
Coming.
We came in early yesterday for bloods. Blood count seems okay now. I had three bags of blood for a transfusion, and they're hoping to operate this afternoon. I met the surgeon, I met the anaesthetist. Here goes to the operation.
While Michael waits for the final go-ahead, back at the outpatients clinic, Carol has her follow-up appointment.
So you've just had chemotherapy, haven't you?
All right, yeah, I had the hat as well.
The hat?
You know, the cooling hat. I didn't find it too bad.
Okay.
Because, you know, it's ice cold, obviously, but No, it didn't worry me at all.
Good.
I should do it next time as well.
Good. Well, your hair's very thick, actually.
Yes.
So with the cold cut, hopefully you'll have a really good chance of
I hope
keeping it.
so, yeah.
Absolutely. Did you have any problems with sickness or anything?
No.
No?
No, I wasn't sick and eating like a horse.
Good. Your weight's gone up a tiny little bit.
I know.
Nothing, only a little bit, nothing to worry about at all. Oh.
I have been naughty, so I got to be honest.
Carol, you're having chemotherapy. I think you're allowed to be naughty,
Yeah.
to be fair. So any other problems at all?
No, nothing really. No, I've been quite well, you know. I've still been doing housework and gardening and...
Surely that chemotherapy's an excuse not to do that?
Well, yeah, it's just... The one thing... I'm sure many people think that, why me? Am I going to be here next year to walk in the garden? And all those things go in your mind. But when last week I went and I had something a bit more positive to say that a lot of the tumours had shrunk, that is when you start to feel a little bit positive about yourself. You know?
Overall, do you think it was better than you expected it to be?
It was, yeah.
Because you were quite nervous beforehand,
Oh,
understandably.
I know,
weren't you?
I know, I know. I have been quite good, in all honesty, yeah. And my husband been very good as well. He's doing all the cooking.
Good. He's listening as well.
Yeah.
As Carol and Michael continue their treatments, the students move on to the rest of their studies with some precious memories.
Carol, she's really inspired me. She's been so positive through the whole thing, and I'll definitely remember Carol.
I'll 1,000,000% remember Michael and Jackie, and they've made me want to be a better doctor in the future, and being there with someone I think at such an important time in their life, you'll never forget that. I'll never forget it.
It's the morning after the operation, feeling really good, given positive results so far. As far as we know, the operation went well. Still waiting to see the surgeon, which will be today. They've ordered my medication on anti-sickness, so today was a nice relief to eat my breakfast straight, no problems at all, and even 2 cups of tea. So things are hopefully looking better.
The treatment for cancer can sometimes seem just as tough as the disease itself. For Velindre patients like Michael, the path back to health is long and hard. But every step forward gets him closer to home.
You're doing fab. Fair play.
You've got to remain positive. You've got to try and make the most out of life. Do as much as we can because you don't know what's around the corner. Just live for today. That's all you can do.
Next time, Pauline confronts the stigma that surrounds her cancer.
Everyone's got a backside, haven't they?
Yes, that's true.
For goodness sake.
Yeah,
It's like, oh.
And Rebecca keeps smiling through 2 years of chemotherapy.
Put the lipstick on, put the dress on, and we go again. That's what we do.
Heartened by a huge gesture of support from her daughter.
And here I am with this.